today, it's my great pleasure to be in conversation with Craig Gear OAM, CEO of the Older Persons Advocacy Network. Craig, with an undergraduate and postgraduate qualifications in nursing, your career has traversed the many aspects of the healthcare system, from primary healthcare in New South Wales, which is the state of Australia, with PricewaterhouseCoopers focusing on mental health strategies and models of care, and specialising in across your career in e-health, mental health, Aboriginal and Torres Strait Islander health, primary health, justice health, and the health workforce. It seems to me, though, at the heart of your professional journey, and after having 2 conversations with you, at the heart of who you are, is this word rights.
I think we missed Jane. We're going to wait just a few minutes so she's back.
Luana, do you want me to jump in while we're bringing Jane back on? I think I know where she was going a bit on that question. And look, it's a real pleasure to be here with you all today. And I want to pay acknowledgement to the First Nations peoples of the country and the lands that I'm on, which is the lands of the Gadigal people of the Eora Nation. And they are people that have cared for this land, and their elders, past, present, and their leaders that are emerging have been people who actually have an absolute grounding in respect for the rights of older people. It is something that we have a lot to learn still right across the world, but particularly in Australia, about the respect and dignity that's needed to be paid to our elders. And I think, Jane, you were sort of starting to talk about sort of the broad career that I've had, and you're right. It's probably seen what I've seen, and what particularly when I reflect on my work that I did in the prison system in New South Wales, and I went there as the after-hours nurse manager to start with, but got into primary health and a really disadvantaged groups there, and people who's just didn't have the ability to have their rights upheld. And it reflected that everyone has the right to healthcare, and that was a real grounding. The person who was in charge there, Dr. Richard, he said, look, the taking away of someone's freedom and putting them in prison is the punishment, not taking away their right to liberty and to healthcare. And so what we were doing there, and particularly with older prisoners, was really looking into how do we actually understand that people sometimes in these marginalized groups or who've been at the edges of society are actually behind the 8 ball, and we don't have just to give them equitable healthcare. We actually they have the right to, I suppose, an overinvestment in their healthcare because they're behind the 8 ball. And if we do that, we actually get better health outcomes. We actually get less crime, and we actually get better transitions back into society. And so, for me, it sort of started to teach me about intersystems connections and how you have to work across systems and across government agencies, and but we also saw a lot of issues around early onset aging, and in that if you did something about that, you actually cost society less, and you actually had people who actually really appreciated the care that they were being provided, the support they were being provided. So it's kind of then something that I've taken now into work I do in not-for-profits, and now with the Older Persons Advocacy Network. And there's a couple of people here, Gwenda and Val, who are big parts of the work that we do, of actually listening to the voice of older people, and actually going, well, hang on a minute, this is not about us. This is about Gwenda, Val, many others, and about how they want their supports delivered, and how do we build an aged care system that actually is there for them. And that's fundamentally what's at the heart of human rights.
And if we just focus on OPAM for just a minute, Craig, it's an independent not-for-profit organisation, and it gives voice to older people at every stage of their ageing and aged care experience. So why is OPAM so necessary in a country such as Australia, which is recognised as a high-income country, a high standard of living and relatively good aged care? And we'll talk about that later. But why is OPAM so necessary?
I think because it's really easy to ignore the voice of older people. Val and I talk about, we have an argument about who's the boss here. And it's really because we have to be there and listening to the voice of older people, but so easily, it's easy to just to say, oh, we think this is what's needed, or this is what's in the person's best interests. So actually, one of the fundamental things that our aged care advocates do is actually say, well, it's not about us. We're here to be, we're on your side. We're partisan. We're actually there to represent you and make sure that your voice is heard when there's issues and that your rights are held up. So we have a Charter of Aged Care Rights in Australia, but unfortunately, too often, it's just words on a piece of paper. So the role of our 200 plus advocates is really to stand beside the older person to make sure their voice is heard, because in any system, but particularly in aged care, I think there is this power imbalance, and it is so easy for us, and I've done it as a nurse, I've done it myself in my nursing career, where it's so easy to decide, oh, this is what you need. It's time for your shower. Come on, just get up and have your shower. This is what you needed. That will make you feel better. Well, no, maybe it's not what you want today. And so it's so easy to infringe on people's rights in really small ways, and that adds up to big ways of a lack of respect and dignity. And that's fundamentally what OPAN's about. What we do is those 9 members of ours here, and the advocates are out there supporting people every day. We had over 27,000 occasions of information and advocacy support last year. And it's hearing each of those issues that people have that we can then take that up to the government and the Department of Health and Aged Care and say, things aren't perfect. We are trying to move and improve the system, but we're not there yet. And so part of my role and our older persons reference group role is to say, not good enough. We still need to improve. And here are the issues that we're seeing are still going on out in the aged care system.
And I think what you just talked about there was evidence, the real world evidence,
Yes.
The voices of individuals. But something happened during COVID, in Australia, and I just want you to talk a little bit about it. So to give context, just a couple of weeks ago, WHO announced that COVID-19 was no longer regarded as a global emergency, but it certainly marked a symbolic end to a devastating time in my life and the life of billions of people. And I wasn't affected, really. I had shelter, I had food, I had access to everything that I needed. But that wasn't the case for many people around the world. And just to put this in context, the pandemic hasn't gone anywhere, by the way. COVID hasn't gone anywhere. In Australia last week, 38,000 cases were reported. Now, I'm not sure whether it's reportable infectious disease, but 38,000 cases were reported, and on average, 5,500 every day. But what role did OPAN play during that acute stage? Because you saw something and you took action. So what was it?
Yeah, and Jane, still last week, when we get through, there's a group of our friends who still sort of talk about the COVID, the K19 group it's called, and instead of COVID-19. And each week, there's one guy on there who just keeps putting up the stats each week with a frown face, because he put up just 2 of our 8 states, 110 deaths last week.
Yeah.
Now, the majority of those deaths will be older people.
Yeah.
They will be who is dying. If it was children dying, we wouldn't be just putting that up and having that statistic come out each week. Now, yes, we are at a different phase of the pandemic, but that's still 110 people that are sitting behind that statistic who are dying, who are family members, who are grandparents of people who are there. And so we still want to get information out to people. One of the things I saw, I suppose, sitting down and was going, when the pandemic started to hit was, but how are we going to get information out, and how are we going to get that out to older people? What's something that we can do in this situation? And it was going, well, what we can do is actually, we can amplify the government messages, we can simplify them, and we can communicate through some of the channels that we'd been using, which was some of the digital stuff. Now, Val kept us very honest there, and she goes, yeah, but what about the people down the street? What about the people who aren't on the computer and those sorts of things? So it was also really important that we were hearing the people who've lived experience and in their communities to say, but this is not getting through as well. And when it got into long-term care homes, or what they're called here, aged care homes, COVID was really devastating, and it took probably the media being out at the doors of some of these facilities to say it's not going well, whereas providers might be saying it's all okay because they were in the crisis response mode. But we had families ringing their loved ones who were in there and them saying, I haven't eaten, I haven't showered for days. And so what we were able to do is then actually have meetings like this on Zoom with families and say, well, what are you hearing? And we could then get that up to the minister and up to government and say a different response is needed. It's not going as you're being told. And so part of that is just holding government to account, again, making sure that voices come through. It was really hard because it was third hand. It was really hard to speak to the people themselves who are in the facilities. And one of the things we want to see is that we plan better for next time about how those communication channels, and that we actually get the messages into the hands of the people who are most affected by this. But we saw a real breach of the human rights of older people during this time. It was older people in residential facilities that weren't allowed to have visitors. It was them who were told that they couldn't go out, whereas I could go out and have a picnic when it sort of eased off a little bit.
Yeah.
But my uncle in an aged care home was not allowed to walk around the block because he couldn't be trusted. Now, that's just a breach of human rights. No one actually had a public health order on that facility to say no one's allowed to leave, but that's how it was done. Now, it was done for good reason, and it was done with good intent, but there wasn't this thinking about the human rights of older people and how that was being done. And then there were people in there who weren't getting home care services in the community because staff were staying away. So it was a big impact, and it still is there. We're not out of the woods yet.
No, look, we're certainly not. But you've mentioned aged care system and rights-based approaches. And to frame the next, couple of questions, I just want you to share with our cafe audience today, what's happening with the Royal Commission, recommendations 1 to 3, and the opportunity of a rights-based legislation system in aged care. Could you just expand a little bit on that?
Yeah, I mean, I might be a little bit, was it Pollyanna, where you think that everything's going to be fine and rosy and everything, but I actually think this starts to shift things to a different parameter. And one of the things that it will do for having human rights enshrined in an Aged Care Act as the principles in the statement, and then more importantly, the enforceability of those rights, is it's just not about what often happens with these systems is it's a risk-based approach and go, okay, is the person going to die if this happens? And we absolutely want to prevent those really serious incidents and those high-risk things. But it's the subtle and low-key stuff of the breaches of rights. Was my right to have my diversity respected? Was my right to make decisions about my own life respected? Was I supported in my decisions? No, they're the things that fundamentally that add up to a really poor experience of life and really poor experience. So what this opportunity is enshrining that in the legislation to be the bedrock to say from here on, we will respect older people. We will understand that they have human rights. Those human rights aren't checked at the door when someone enters aged care or gets support from a home care service. And we actually need to listen to older people and actually take direction from them about how they want care delivered. One of the other great things is we've now got a council of elders, which is actually speaking to government about those reforms and about how that statement of rights will be enshrined in the legislation, but more importantly, how it's going to be enforced in the legislation and what's going to happen when inevitably there will be times when it's not upheld. But we'll work through that and we'll have restorative justice, and we'll actually go, we can do better, and providers want to do better. So it's not about the providers going, we don't care. It's trying to build a system where we've got this continuous feedback loop that says this is how we improve and change the system. It's a big ship. We've got to take it. It's like one of those big oil tankers. We've got to turn it. It's going to take time, but this is the pathway to help start turning this ship into something that's much more respectful and has older people at its centre.
Craig, you've got this really unique ability to talk about a very complex issue in bite-sized pieces that certainly I understand. So thank you. Now, I didn't know until you told me earlier that under the Aged Care Act, there's 11 special needs groups. So can you speak a little bit about that? Because, many countries struggle with older homeless people, the facilities for older LGBTQI2S peoples, Indigenous peoples. Can you talk with me about how the aged care system responds to group?
Yeah, and we haven't got it. We're far from perfect, but actually having, I suppose, those diversity populations named as target groups within the Act, and also in our framework that we have to do as advocacy organisations, we've got a target. We've got to reach 20% of, let's say, the special needs groups. Not a great term, but we can work on that. But what it's really saying is you've got to have a different response, either because people have lived trauma, or people don't trust government, or it's really hard for them to understand government systems. So we've got to do something different. If we do it different for these special needs groups, we'll do it better for everyone. One of the projects, and I've got it here, is our Who's Missing diversity planning, because no one wants to be treated the same. People want to be treated individually and their unique life experiences and life circumstances to be understood and respected. It's the third right in the Charter of Aged Care Rights, about having my diversity respected and supported. And particularly around LGBTQI, there is a need to actually understand that people have been traumatized by systems in the past. They've been discriminated against. Trans people can continue to be discriminated against. And we need a system that actually understands how to provide culturally safe services so that someone doesn't have to go back in the closet again when they come into aged care. And that's some of the work that we're doing, is looking at the broad range of things that you can do to actually know who's in your community, and actually then think about, so how am I going to make my service that it's so accepting, but not just accepting, it's affirming of people's life experiences, so that people are going to feel safe, they're going to feel culturally safe, we're going to actually have trauma-informed care, and we're actually going to be able to deliver better outcomes for people, and people will want to come. It's really good for business as well, because if a provider gets that right, everyone's going to want to be there. Some of the best service I've seen are actually the homelessness services that we provide by a group called Wintringham, because they're lovely, trauma-informed, open settings, lots of room, and really respectful of people's rights and choices and their independence. So I think if we can get it right here, we can get it right for so many people. Jane,
You're
I've
muted,
just
Jane.
You just used a term there that I'd like you to unpack, and it was trauma-informed. What do you mean by that?
So we had a group that we went and spoke to called Forgotten Australians. These were people who had either been taken into care, they were our stolen generations of Aboriginal and Torres Strait Islander people who'd been taken away from their families. They might have had children that have been put up for adoption. That is significantly traumatic, and what that does, and also from an intergenerational trauma of how that's gone down from many generations, means that that person does not trust the system. And why would they? If the system has taken away your child, if the system has taken you away and put you into care. And so that understanding why a person might react, why they might be particularly loud, aggressive, whatever, or why they might not actually want to engage with your service, until we get that right, you suddenly go, I understand why that person might have particular ways of interacting, but I can work with that once I've actually done that, and I can still make them feel safe. And I can provide them a support environment that works for them, so they can thrive, really.
Look, thank you for that, because that sort of leads into another question a bit later on. But I had the pleasure of listening to an interview that you gave, and Luana's going to put it into the chat box, where it was stated that since September last year, there'd been a number of aged care facilities closing their doors in Australia. And the sector is really grappling with how to deal with these massive aged care reforms and one of them included 24/7 mandatory nursing. But so I wanted to put that frame of reference, but I really wanted to talk about, the star rating system, which was fairly controversial. And as we talked, it reminded me of the TripAdvisor, where I kind of go, yes, it was great, 5 stars. No, it was terrible, 2 stars. Can you talk with us about the value of this star rating system?
Yeah. So what we'd heard and what families in predominantly, but also older people are saying, if I need to make a decision about where someone goes, particularly in residential care, aged care home, how do I know what good looks like? And particularly, how do I know where to avoid? And it's really, really difficult. And it was often word of mouth. And so what this system was trying to do is build over time a way to say, look, these are the minimum standards, and this is the minimum standards of hours of direct care support. This is the quality standards by our Aged Care Quality and Safety Commission, and have they met those standards? But importantly, a third of that rating is about, so what are the people that are using the service, the residents in that aged care home, the people in the home, what are they saying about the service, and having an independent assessment of them, of what they're saying their care is like as well. Now, none of this is perfect first go, but it's the sort of transparency that we want to start to see. And we don't think that anyone should expect any less than 4 or 5 stars. So we really want to see all boats rise. And that takes time and it takes money. But some of these, I suppose the challenge with some of these reforms is it's about money flowing to say these are sorts of the things that we should expect from the system. If you're an aged care home with high dependent people with high care needs, there should be a nurse on site at least all the time. Now, there should be also a whole lot of other supports and services there as well. And so I think over time, and some of this part, the other part of this is the quality indicators, how many falls, how many medication errors, those sorts of things are happening as well. So it's trying to bring a whole lot of different aspects of what good looks like, but then saying, okay, so what are you doing about it? If you're sitting at a 3, how are you going to move to a 5? Because you shouldn't be resting on your laurels. Everyone deserves really an aged care 5 stars. And that still should be a minimum expectation, I would have thought, these days.
Yeah, Craig, you're the eternal optimist, aren't you? It's very rare to be in conversation with someone that is sort of embedded in, aging and aged care, to know the problem in such detail, but also to be able to be optimistic that the solutions are there. So now I want to turn on to, a very, very sensitive and often taboo subject in our society, and it shouldn't be. But OPAN have really put this front and centre, and that's the Ready to Listen project. I shouldn't have been shocked, but I was taken aback when the data says that an estimated 50 sexual assaults take place in residential care in Australia every week. And clearly that trauma experience is compounded by a lack of education for service providers. Now, you have taken up this cause with great vigour, and I was so impressed to see the resources. So could you talk with us about this, the why? Why is OPAN taking this and shaking it? And also about the Ready to Listen project, which is fantastic. So, Luana, could you put a link to the Ready to Listen project? Thanks, Craig.
Yeah, and while I might sound as the eternal optimist, I think that's not, because there's still 27,000 occasions of poor support, poor care, or poor lived experience, life experience of someone in this system that we're hearing each year. And this is the particularly really, really pernicious and horrible one, where one sexual assault is one sexual assault too many. And I suppose I didn't believe the figures. I thought, yeah, that's an overestimation. Our serious incident response scheme, which has been in for maybe 18 months now, and the last quarter that's been reporting up to December, 565 cases of inappropriate sexual contact or sexual conduct is what they use there. We sort of summarise it down as sexual assault. Now, yes, there probably is some parameters in that, but we don't know that quite yet. but that's 4.7% of all the serious incidents in that quarter. That's 47 per week. So that's pretty much stacking up to the numbers. So on the pure numbers of have we got an issue? Yeah, we've got an issue. Even if it's people feeling that that's happening to them and not feeling safe. So Catherine Barrett came to me, Dr. Catherine Barrett, and was saying, we've got to do something about this. I also heard the story of Marguerite Solis, who was at a conference and who spoke up about this. And that was really brought home to me that we just aren't equipping our aged care workforce, our families and the providers in how to actually deal with this. And in the positive side as well. So there's not knowing how to deal with, how do we actually enshrine the right of an older person to still have sexual contact and sexual relations with someone in a safe manner. So this is really how to get the pendulum right was what I was thinking. But what really brought home to me was there was a KPMG study that talked to staff, and 58% of the staff who that said, oh, the sexual assault won't have any impact because it's someone with dementia and they won't remember it. And that is just shocking. And so it meant that we needed to do something around in a right way of educating people and actually thinking about where they sat in this situation and what all of us as a collective could do. And it wasn't just us, it's not just OPAD. There was, and members, some of them are here, is a dementia special interest group that we're continuing on to look at it from the lens of the person who's living with dementia about what they want and how they want consent to happen, how they want to be feeling safe in environment, and particularly about if things do change, how do they want those things to be put in place so that it's a safe environment for everyone. So again, it came down to these human rights and how do we balance the human rights of everyone involved. And it's something that it needed to happen. It's not comfortable. But it's something that we do need to speak up about, and we do need to actually work out ways of doing it and the support services, how to prevent it. But then if it happens, how do we support everyone involved? And we listen to the person who says that that's happened to me. And I think too often we weren't listening because we say, oh, what couldn't happen? And again, that's ageism and that's discrimination to think that older people, it can't happen to them. Of course it can. And we just wanted to prevent it.
Yeah, look, thank you for that. I'm just going to just go to some questions first of all. Now, Shmuel comes to Global Cafes every single week, and his question today, is really about, in Australia for older adults from poor and low socioeconomic groups, how are their rights supported and protected, in Australia? Are they any different? So, for example, Indigenous peoples. Are they regarded as one of those 11 special groups? How do we deal with those? Perhaps if I can ask the question another way, do people who are socially disadvantaged have the same rights in going into a facility or the same rights in receiving home care? Perhaps you could take it from that angle.
So in theory, yes, but in practice, possibly not. Now, partly that might be barriers like I talked before around intergenerational trauma or history of not trusting a system. So why would I go and engage with a government system that's ripping me off or taking me away? And particularly, why would I go into an institution when I've come out of an institution that's just traumatized me my whole life? So to go back into aged care could be really re-traumatizing. So I can absolutely understand why there needs to be a different model of support, and that's basically support at home or enough support around a person so that they can make choices to live in smaller, safe environments. So it's probably more service access. So on paper, you could say, yes, there's ways of someone that's low socioeconomic to have what's hardship allowance and they'll still get the services. But the reality of it is that higher glossy facilities, not necessarily saying they are good or better, but there's a lot of money needed to go into those, and the concessional beds would be less of that. So no, we've got a long way to go. We've particularly got a long way to go with remote communities and making sure that people can age on country and they can also make decisions about who they want to be caring for them as well. And we've also got still a lot of issues that as people get older who have being living with a disability, that they get the same access to supports than other people who might be younger who have a disability as well. So theory into practice, I think on this one, we've still got some long way to go. And then I've talked about sort of aging at the margins and the edges, and then that's can be particularly challenging as well.
And Shmuel says, thank you very much. Great model. Let's implement it globally. I'm going to call on Cynthia Stewart, Dr. Cynthia Stewart, the main representative for IFA at the United Nations. So Cynthia, you're coming from lovely Maine. Yes.
I am this morning. Thank you, Craig. This is very, very fascinating. Regarding the sexual assault data that you were sharing, which is of course atrocious, I'm assuming that most of the sexual assaults are against women, but not necessarily always. And if so, how look in your crystal, how would you change, the lifelong sexism that girls and then women encounter over their lifetime to make it different? Any thoughts on that?
Yeah, get men out of the way. That might start the process and actually understand, as my chair, who's a very strong advocate for women's rights and older women's rights, would say that us men are part of the problem, and we need to understand those risks and challenges and the lifelong discrimination. I was talking to my mum last weekend, and my dad's recently passed, and she was trying to get the credit card increased. Now, a bit of a Western problem, but they were questioning her, why was she spending money on childcare for her great-granddaughter? Could she really afford that? And in that was the fundamental ageism, but the fundamental sexism that sat behind that. And I went, I would never be asked that question. My dad would never have been asked that question. So why are we asking an older woman who they know could actually finance that? So there is something that's just quite wrong with this intersectionality of ageism and sexism that is coming together. And it does play out in the sexual assaults, and actually going, well, we don't see older women as being, I suppose, respected or attracted in society. So therefore we've diminished them, and then even the thought of sexual assault becomes something foreign. So we're also trying to work with our domestic and family violence services here, and what is called our 1-800 respect line, which is it does look at for younger women, but are getting to them to understand that they need to respond to older women, knowing the risks of homelessness for older women as well because of finance and gender inequity. So we've got to get the pay right, those sorts of things as well, and that sort of financial equity in there as well. So I don't have all the answers, but I know that men have to be part of that.
Okay, thank you. Now it's my great pleasure to introduce Frances Zanadin to pose a question. Frances is also a representative for IFA at the United Nations, and probably one of the most positively disruptive activists in this field. So Frances, the floor is yours.
Thank you very much, Jane, and thank you, Craig. It's really enlightening to hear so much is happening in Australia, but the fact that you have to do all this work is an indictment on government or lack of government policy. I'm sure you know, and of course you do know, that things are happening at the global level, at the UN. There is an open-ended working group that's been established to discuss the feasibility of having an international legal instrument to protect the rights of older persons, much like the Convention for on the rights for persons with disability, women, children. Australia is currently engaged in the process of all these discussions, but it has not come out to say that it actually supports having a legal instrument. Do you think that such an international instrument, which would address minimum standards and will codify the rights of older persons, would you think that this would help national causes and national legislation? And is OPAN advocating for such a convention? Thank you.
Absolutely, yes, and absolutely we are. So what are the missing pieces when you look at the other instruments? And from my understanding, I'm not going to get them all right here, but the right and access to health, the right to access and continue to be part of your community, and fundamentally the right to live free of discrimination, the free of abuse. Now, you can pull some of these threads from other international conventions and instruments, but there's missing pieces there. And I think COVID-19, from my reading of the international work, is that the United Nations themselves are now saying, or the special rapporteur has been saying, that there is these missing pieces. And why we fundamentally are not respecting the rights of older people is because we don't have something that actually says, and it fundamentally comes down to discrimination and ageism, that we don't value the older person and their contribution still, but that's taken away. And the fact that the rights of people to freedom of movement during COVID was inexplicably more restricted on older people. Now, yes, we know that the COVID-19 impacts older people in a greater manner, but that doesn't mean that you take away people's right and choices of how they want to live their lives. So I think there's some missing pieces, and it's probably it's challenging for us to bring in human rights into an Aged Care Act because there isn't that international convention on the rights of older people. And it's broader than just aged care. And it's needed to be there because we can still, there's some things there around the Convention on the Rights of Persons with Disability, and particularly around supported decision-making, but that needs to be enhanced, and we're not taking the rights of people to make decisions about their own life, no matter how their life is or level of cognition. I think that we haven't got that right yet, and that's why we need an international convention.
Thanks very much, Craig. I'd just like to alert everybody to the chat box and comments by Gwenda Darling. Thanks, Gwenda, for putting that information in. I now turn to Robin Abrahams. Robin, you've made a couple of comments, one around ageing and disability and one around sexual abuse and, you know, the law of the land. Would you like to pose a question to Craig?
I actually guess I wasn't really looking to ask a question. I was just making serious comment. I am an older person. I am significantly disabled, and I have been a primary carer to my parents. So all three of these things are precious to me. My mother was sexually assaulted in an aged care facility just not long before she died, which is August of last year. And I found the system totally and utterly inadequate, both within the aged care system and within our law of our land of this good country we live in. Basically, nothing was done, nothing could be done. And I was shocked, horrified and dismayed, and worked very hard at trying to fix that. So whatever efforts you can all make to fix that, I would be forever grateful for myself and all of us as we get older, and those that are there now. It certainly does need to be fixed. And in terms of aging, I think it's three things. We get old, we get sick, and we get disabled. Some of us are all three of those things to start with. And we shouldn't try and make them three separate things all the time. Somehow they've got to blend. How are we going to deal with just some of that, please, Craig?
Okay, thanks, Robin, and thank you for, you know, coming to us today and sharing, you know, what I'm sure all of us would see as abhorrent. So thank you, I appreciate it. So Craig, you know, a comment.
So we know that there's inequities, particularly even in our system in Australia, which is a well-off system that is providing supports for people based on need, particularly those who are in disability, but a strange cut-off at the age of 65. We've got to make sure that this new supported home program does better at that. And it's going to be champions like Robin, Gwenda, Kathy, Val, others here who will keep people honest to say that there is certain things and systems that you need to help you continue in your life. And that doesn't make on a chronological number or a number that says 64, that's okay, 66, that's not okay, you don't get that. So I can't say it's right and I can't say it's equitable, but we've got to find some time where it actually is manageable and sustainable at the same time, but meets the assessed needs of people. And that's really what it comes down to, assessed needs. That's what you need.
I think also, Craig, our policy is so far behind in terms of the demography. We're still talking about dependency ratios where the working age is from 14 to 64, which is not true, but we still use that in the policy development. And you're quite right, 64, 65, 63, 75, and policies around access to healthcare, access in our country, in Canada, access to certain vaccines. It can be, a 64 or a 65. And that means that that's a barrier to someone actually maintaining and improving their health and well-being. And I see Kathy nodding. So thank you, Kathy, for nodding.
Yeah, and having seen, and this is where it comes down to also thinking about individual and diversity groups, because having come out of the prison system and seeing early onset aging, or the people that are aging at the edge of our society, why haven't we got an equitable system that also recognises that some of these life issues can come on earlier, just not because it's the number that you tick over each year on your birthday. It's because of the different supports you need at different times of your life, and they can come in for various different reasons.
And I think also you've touched on this environment. We believe through our work in healthy aging in the decade, it is how do we create this environment that enables. Now, you've mentioned the prison system. We've got life termers in the prison system, who have disabilities, who have dementia, who have changes. So it's about how do we actually, align, the person and their environment, which may actually change over time. So I want to swing back round to dementia, not as a diagnosis. I want to talk about how we create the opportunity for people with functional changes, with cognitive changes, to live in society. Because I think sometimes we're actually stigmatizing through diagnosis. And so I'd be really interested because, dementia is a big call on every government's agenda. Not to say that governments are investing in it, because they're not. But from your perspectives in OPAM, where is the conversation going around, I think, prevention of cognitive decline, so lifestyle work, as well as the services that will be required and the training of professionals? Sorry, it's a big question, but I've only got you for another 10 minutes.
Yeah, and I'm not, there's much more, there's experts sitting in this room here, and experts with lived experience who are much better to talk about this from their perspective of what they want in their lives, and that's important. What I can say is that what I'm seeing is the fundamental taking again away of people's rights to continue to make decisions about their lives and about what their wishes and preferences are. And that is fundamentally at the root of ageism and a lack of supported decision-making in our system. And we've had 2 royal commissions. The first one didn't deal with supported decision-making. The Disability Royal Commission is saying fundamentally underpinning the issues in this system is that we're not allowing people to make choices and stay in control and stay independent in their lives. And we take people through the Charter of Aged Care Rights and they get to right 9 of my right to my independence. And they go, oh, I like that one, because it's actually fundamentally say, I want to still stay in control. And then I'll instruct people about how I want things to happen. Teresa Flavin, who's one of our reference group members, but talks about a social directive so that she can instruct others about how she wants life to be treated and how she wants to be treated in different situations. It's different to an advanced care directive, but I think fundamentally, if you had that in place, you would be able to support someone in making their decisions, and you wouldn't be making decisions for people. And too often we're seeing that. We're seeing people going under the public trustee and the public guardian, or enduring guardians who are not understanding the absolute fundamental privilege it is to work on behalf of someone else, to take direction from them. And that's what our advocates are there to do, is to take direction from someone and actually enact what they want. But there's others here who will say that more, I mean, on that, we absolutely need more training. We've had some absolutely harrowing cases in the last few weeks here in Australia where there is not an understanding of the perspective of what the environment feels like for someone living with dementia in a crisis point, where we're enacting trauma on them, and the results are horrific. So we need to get better with training. It needs to be across all of our community. It needs to be with our aged care workers. It needs to be with our first responders. We've just got to invest in it. We've got to do it.
Look, thank you for that. And I just direct everybody to the chat box. Val Fell has just popped a comment in the chat box around experiencing ageism because I'm 94 and people even think I'm too old to have a glass of wine. Touche, Val. Truth. That is truth. So one of the things that really irks me, Craig, is when someone says what older people need to do is be empowered. We need to be empowered, to have a voice. If I actually said that to my mother when she was alive, bless her, she actually wouldn't know what I was talking about. What do you mean? What do you do? So I ask you, I make that statement about empowerment because it really intrinsically says we actually respect the decision and the voice of the people around us, and that will include older people. But I want you to touch on this self-advocacy toolkit, because in and of itself, it's about putting me in the driving seat with sufficient information to make decisions. And I think this self-advocacy toolkit, is very important for everybody on here. And I'd like, Luana, for us to, with Craig's permission, to profile that at our global conference in Bangkok. I think it's a very important toolkit. Craig?
So in the words of a wise woman, knowledge is power. And Pinky here, Gwenda Darling, who actually said that, is the poster person for that. That's what it's about, because it's about just going, well, there's no point me doing it. If I could do ourselves out of a job and we didn't need our 200 advocates, that would be success for OPAM, because we'd be actually going, we've given people the confidence to speak up for themselves. We've given people that they're not fearing retribution from their provider. We've got people to the point where they can say, yeah, but I know what the inclusions and exclusions manual says, and you will give me this because that's what I'm entitled to under my home care package. So if people are giving that knowledge and that power, that's what empowerment is, because you can do it for yourself. Now, some people don't feel as confident at the start of that, and that's why our advocates are there to help them for that. But that's what self-advocacy is giving people the skills, knowledge, and confidence to say, I want to stand up and do this for myself. I don't need you, Craig, to do this for me. Get back in your box. I will do this for myself. Thank you very much.
Look, absolutely true. And please follow Gwenda, in the chat box, once again, putting some, Gwenda, did you want to say a few words? Because you popped lots into the chat box. So would you like to say a few words? Unmute yourself.
Thanks. Don't start me, because I don't stop once I start. It is true, though, that nobody knows my needs better than me. As I say, it's even my family sometimes think they know what's best for us, but we know what's best for us, and we know the way we want our services delivered. Can I just say, please don't talk about prevention of dementia. It puts a whole guilt trip on the people living with dementia. It's suggesting lifestyle things that may delay dementias, because it's not my fault. I've got it. I've never drunk. I've never smoked. I've never taken an illegal drug. Didn't even take Panadol till I was in my 50s. We don't know what causes it. There's not enough research yet. And I'm really passionate about people speaking in the right language so as you don't blame us. There's only one way out. There's no cure. We know where we're going, but we don't need to be blamed as saying we could have prevented the disease. I don't know if that's what you wanted from me, Jane, but that's what I've said.
But it's also clear, isn't it, about then you actually still going, yeah, and I'm going to tell you how the support and care is going to be provided. And,
Absolutely. Don't give me a doll.
Yeah.
Don't give me a doll in a nursing home. I never liked my own babies, let alone wanting a doll. Everybody, you see one person with dementia, you see one person. Just like you see one older person or age person, you see one. We are all different and we all want our own needs met in our own ways.
Look,
thanks, Craig.
Thank you very much, Gwenda. And whatever you say is whatever you say. So very, very happy for that. And thank you. And thank you for being with us. So Craig, just one last question, and it's been really an inspirational conversation, but I want to come back to you and I want to come back to OPAN. So what are your ambitions and future milestones for you as in Craig Gear? And what about OPAN?
Look, the success would be that we didn't need OPAN and we didn't need people to walk alongside people, because we've actually given them the absolute confidence, as I said, and we've done ourselves out of a job. I think we've still got a few years to go on that. But really, to me, to get out of this job, I really want to see human rights enshrined in the Aged Care Act, but there's a pathway for people to have able to have something done about that when that right is breached, so that the provider, the older person, the person, the whole network can sit down and go, how do we do this better? So I'd love to get out of this job knowing that that's in place, so that people can have confidence that they're going to be heard. That's really what's important to me.
Okay, well, I think, Craig, you're in it for a little while longer. But I'm going to leave you for a couple of minutes and just introduce next week's speaker. But before I do, please, everybody, go through the chat box and have a look at all of the comments. I noted the comment from Zacchaeus around the UN Convention, but also the note from Alan Graham, you know, thanking OPAN for their spirited collaboration and partnership, you know, around the convention. So, you know, we really are building community, and it's about building community to ensure that the rights of all people and older people are both protected and respected. And I very much concur with Gwenda's comments about we're all individuals, we're all unique. So, you know, this is me, and I'm the only one that knows what I need right at this moment in time. So come with us on another journey next Friday at 7 a.m. Eastern Standard Time, and be in conversation with Ryan Backer, the co-creator of the Old School Anti-Ageism Clearinghouse. So the title of this conversation next week is The Power of Conversation to Dismantling Ageism. So thank you very much for that, Luana. Now, Craig, we always return to our expert. And by the end of the hour, you know, we're almost family, because we've talked about all sorts of things, about you, about the work, about the future. But we like to hear from you and the takeaway messages, whether they're practical, philosophical, futuristic. Give us some messages that we can take with us today.
One, back to that fundamental that you can do this for yourself. You can self-advocate. We can support people to do that for themselves. I reflect on also that human rights are everybody's rights, and also Ashton Applewaite we heard speak a couple of weeks ago, and she was talking about the interface between ageism and other particular issues. And in Australia, we're about to face a referendum about a First Nations voice, and recognising Aboriginal and Torres Strait Islander people as the first peoples of this nation and the sovereign owners of this nation. And in doing that, we also see that you can't just be have be a single issue rights person, because wherever you see rights impacted, we all need to stand up for that. And I think we'll all see those different things, sexism, ageism, racism, homophobia, right across different aspects of people's lives. So I think that's that we've all got work to do in the human rights area. I want to thank everyone here for joining this, and this feels like a bit of international family all working for different aspects of rights. So and thank you to the lived experience and experts in the room as well, which is again a takeaway for me of how important it is to hear those who are there, who are recipients, who are the people who this needs to not be done to, but who we walk alongside. So thank you.
Thank you. It's been a great pleasure, to talk with you this evening in Australia. And I want to thank all of those, in the Global South that have joined us, and particularly, members of OPAN, the network. And I want to make special note of those over 200 ambassadors that you have, because that's really, the heart of OPAN. So thank you very much for your time. And to everybody that's joined us today, join with us again next week. Thank you to the IFA staff who are incredibly dedicated and busy at work, in the advanced preparations of the global conference, and particular, Luana Colnago, thank you for making this happen today. And also finally, Craig, to our director, Sam Edmonds, who introduced us to OPAN and yourself. So stay safe, stay well, and enjoy the weekend. Thank you very much for being with us today. Thanks, Craig.
Thanks, everyone.